Hello and welcome to our channel. In today's video we will discuss about a very important topic, that is hypothyroidism. So let's start. So first of all, we would like to discuss about basic anatomy of thyroid gland, which one should know. So which is found in the neck, and it is responsible for regulating the body's metabolic rate via hormones it produces. The thyroid makes the hormone T3 and T4, which controls the metabolism, how your body uses and stores energy. Now we'll talk about the anatomical location of thyroid gland. So the thyroid gland is a ductless alveolar gland which is found in the anterior neck just below the laryngeal prominences, that is Adam's apple, spanning between the C5 and the T1 vertebra. It is roughly butterfly shaped with two lobes wrapping around the trachea and connected in the middle by an isthmus. The thyroid gland is not usually palpable. It is supplied by superior and inferior thyroid arteries, drained via superior, middle, and inferior thyroid veins, and has a rich lymphatic system. So this was all about the anatomy of thyroid gland. Now next we will discuss about what is hypothyroidism. What exactly is the meaning of hypothyroidism? So hypothyroidism, which is also called as underactive thyroid, is a condition in which your thyroid gland doesn't produce enough in certain crucial hormones, that is T3 and T4. So this is the basic meaning of hypothyroidism. Now next we will discuss about the pathogenesis of hypothyroidism. So the image given here on the right side depicts the hypothalamic pituitary thyroid axis. Now let us discuss about the pathogenesis of hypothyroidism. So decreased production of T4 causes an increase in the secretion of TSH, that is thyroid stimulating hormone, by the pituitary gland. This TSH, that is thyroid stimulating hormone, then stimulates hypertrophy and hyperplasia of the thyroid gland and 5-deiodinase activity, thereby increases T3 production. So this was all about the pathogenesis of hypothyroidism. Now next we will discuss about hypothyroidism and pregnancy. That what is the role of thyroid gland in pregnancy and how hypothyroidism affect pregnancy. If a pregnant woman suffers from hypothyroidism, then how it affects her. So we will discuss about pregnancy and hypothyroidism. So let us discuss about it. So hypothyroidism during pregnancy is not common. However, the symptoms can be overlooked because some mimic the hormonal changes of normal pregnancy, such as tiredness and weight gain. If this is left untreated, maternal hypothyroidism poses a risk for both mother and baby. A pregnant woman's thyroid hormones are vital not only for her but also for the development of her baby. Pregnant women with uncontrolled hypothyroidism can get high blood pressure, that is hypertension, anemia, and muscle pain, and also weakness. There is also an increased risk of miscarriage. and premature birth of the baby, that is before 37th week of pregnancy, and even it may result into stillbirth. So this was all about hypothyroidism and pregnancy. Now next, we will discuss about what is the basic etiology of hypothyroidism, that what are the causes of hypothyroidism. So the first etiology is autoimmune diseases. The most common cause of hypothyroidism is an autoimmune disorder known as Hashimoto's thyroiditis. Autoimmune disorders occurs when your immune system produces antibodies that attacks your own tissues. Sometimes this process involves your thyroid gland. So this was the first reason. Now the second cause, that is over-response to hypothyroidism treatment. So people who produce too much thyroid hormone, that is hyperthyroidism, are often treated with radioactive iodine and anti-thyroid medications. The goal of the treatment is to get thyroid function back to normal, but sometimes correcting hypothyroidism can end up lowering thyroid hormone production too much, which results in permanent hypothyroidism. So this is the second cause. Now third cause, thyroid surgery. Removing all or a large portion of your thyroid gland can diminish or halt the hormone production. In that case, you will need to take thyroid hormone for life. Next cause, radiation therapy. Radiation used to treat cancers of the head and neck can affect your thyroid gland and may lead to hypothyroidism. Next reason, medications. A number of medications can contribute to hypothyroidism. And another causes are congenital diseases. Some babies are born with a defective thyroid gland or no thyroid gland. In most cases, the thyroid gland didn't develop normally for unknown reasons, but some children have an inherited form of the disorder. Often, infants with congenital hypothyroidism appears normal at birth. That's one of the reasons why most states now require newborn thyroid screening. So this was all about the congenital disease. And the next etiology, that is pituitary disorders. A relatively rare cause of hypothyroidism is a failure of the pituitary glands to produce enough thyroid stimulating hormone, that is TSH. Another etiology, that is iodine deficiency, the trace mineral iodine found in our body. So this was all about the etiology of the basic causes of hypothyroidism. Now next, we will discuss about what are the types of hypothyroidism. So basically, there are three types of hypothyroidism, as you can see here on the screen: primary hypothyroidism, secondary hypothyroidism, and tertiary hypothyroidism. Here secondary and tertiary are both similar. Now one by one we will discuss about the types of hypothyroidism one by one. So let's start. So first of all, we have primary hypothyroidism. So when your thyroid is being stimulated properly, however, it isn't able to produce enough thyroid hormones for your body to function properly. This means that your thyroid itself is a source of the problem. So this is the primary hypothyroidism. Now secondary and tertiary hypothyroidism. In secondary and the tertiary hypothyroidism, your pituitary gland isn't stimulating your thyroid to produce enough hormones. In other words, the problem isn't with your thyroid. So this was all about the types of thyroidism. Now next we will discuss about the clinical features, that is signs and symptoms of hypothyroidism through which one can know whether they are suffering from hypothyroidism or not. So let us discuss about the signs and symptoms, that is clinical features of hypothyroidism. So signs and symptoms of hypothyroidism varying depending on the severity of the hormone deficiency. Problems tend to develop slowly, often over a number of years. Now, let us discuss about the signs and symptoms. So, first symptom, increased sensitivity to cold. Second symptom, that is constipation. Next, dry skin. Next clinical feature, weight gain, puffy face, hoarseness of the voice, muscle weakness, elevated blood cholesterol level. Next, muscle aches, tenderness and stiffness. Next, pain, stiffness or swelling in your joints. Next clinical feature, heavier than normal or irregular menstrual periods. Next, thinning of the hairs. Next, slow heart rate. And the most important sign is depression. And another important sign and symptom, that is impaired memory. And also another clinical feature which is very important, that is enlarged thyroid gland, means goiter. Now next we will discuss about hypothyroidism in children and teenagers, and also we will discuss about the signs and symptoms. So in general, children and teenagers who develop hypothyroidism have the same signs and symptoms as adults do, but they may also experience. So the clinical features like poor growth resulting in short stature, delayed development of permanent teeth, delayed puberty, poor mental development. Now signs and symptoms of hypothyroidism in infants. So first, that is yellowing of the skin and whites of the eyes, that is jaundice. In most cases, this occurs when a baby's liver can't metabolize a substance called bilirubin, which normally forms when the body recycles old and damaged red blood cells. Another symptom, a large protruding tongue, difficulty in breathing, that is dyspnea, hoarse crying, and last symptom and sign, that is an umbilical hernia. So this was all about the signs and symptoms of hypothyroidism in adults, in children, in teenage and old persons. Now next we will discuss about the investigations, that how one can access whether they are suffering from hypothyroidism or not. So let us discuss about the investigations and diagnosis of hypothyroidism. So first diagnosis, that is decreased serum concentration of total T4 and T3 hormone. Second, decreased T3 resin uptakes. Third, decreased free T4 index. Fourth, increased serum concentration of thyroid stimulating hormone, that is TSH. Next, raised cholesterol triglyceride level. Sixth one, that is X-ray, in which you can see in children shows bone age is delayed relative to chronological machine. They will show sinus bradycardia and low voltage complexes and ST-babe abnormalities. So this was all about the investigations by which you may diagnose whether you are suffering from hypothyroidism or not. So this was all about the investigation. Now come to the management part and treatment. So basically we will discuss about how one can treat hypothyroidism by using homeopathic medicines, that we will discuss in next video, that is in the part 2. So that's all for today. See you guys in our next video with treatment and management of hypothyroidism by using homeopathic medicines. Till then, stay connected with us for more videos like this. Don't forget to subscribe our channel and Press that bell icon for more updates. Stay safe, stay healthy, meditate every day, daily, and exercise at least for 1 hour. And yes, thanks for watching our video. See you guys in our next video, that is management and treatment of hypothyroidism by using homeopathic medicines.